How do we as clinicians support blame and shame for our clients? One of the things that naturally comes up in any body, any human experience of oppression is that shame and blame arrive and are urgent. So how do we support blame and shame in our clients? Personal experiences are very welcome. There's no wrong answer.
I think when there's like an opinion expressed in the feedback given, or like I think about a time I went to therapy and I shared something that I was feeling a lot of shame about, and the response I got was, well, like the shame will be less heavy soon. So she was agreeing with the shame and kind of like I think she was attempting to show empathy, but instead she validated the shame. So I think that might be, and I think that was unintentional as well. So that might be one area.
I appreciate both of those. Give it voice and validate.
I think sometimes we normalize things, which is pretty much what Casey was saying. And we do it within our own culture and others as well, because it becomes a mindset and a mentality. And so when you have that mentality, even if it's within your own culture, sometimes you can forget and kind of sweep it under the rug. And it becomes no big deal because it's a way of life. And if you're not careful, you're going to do the same thing in therapy. I got attitude, y'all. I'm going to turn my mic off because this is affecting.
I'm sorry. I hear it. I hear it. Oppression is hard to look at because it does provoke shame in the body. So thank you for being honest. This is a safe space to talk about our own feelings as well, right? And I think one of the reasons we picked the topic is because it's hard to deal with our countertransference when our clients start to bring up their shame, when they start to blame the systems that they are feeling trapped by. So in this safe space, we start to process it for ourselves so that we are more able, more ready to be present when we hear it in the room, when we're least expecting it.
One of the things that I do with my clients is to do psychoeducation around exactly what blame and shame is, because most of them don't I shouldn't say most, many of them don't have an understanding of exactly what shame is. And then the other thing that I work on with clients is getting them to tell the whole story. Oftentimes they will get stuck in their shame and not recognizing that they in fact are growing out of the pain of the shame, and to help them take responsibility as well as responsibility for any acts that they may feel shame about. Help them to understand that in some instances, blame is correct. And that's what I mean by getting out of the whole story. And then to talk to them about how internalized shame affects them physiologically as well, has helped move some clients out of feeling shame and then blaming themselves for feeling shame.
Thank you, David.
I'd like to add on to what David said in terms of how to help the client articulate their experience. Is I will often try to differentiate with the client between guilt and shame, because by the language of oppression, what will happen is the oppressed will feel guilty for not meeting the stereotype, if I'm understanding what that really means. They have internalized that identity and then look at themselves through that lens. And so they will mistake shame and call it guilt. And so I'll offer language around guilt is really when we have that internal compass of, oh, my bad. We identify that we were at fault and that we have amends to make, or we have adjustments to make to how we approach the world and our relationships in the future. And to ask the client, is that what's happening here? And that will, my hope is that will lead to some kind of short circuit in that definition of guilt, and then maybe more properly identified it as shame, and then, to lead into what David was describing.
Excellent move. Appreciating it very much, Jeremy. Knowledge is power, but how we get our clients to connect to their own wisdom is really important. And I like what Jeremy said about the short circuit. Our bodies do sound alarms. Nobody has to tell a body to sound alarm. When you are provocative in your conversation, when you are provocative in your line of questioning, when you stay deeply curious with your client, you are going to set off some alarms that help them say, wait a minute, what? And then that digging deeper can happen. Really,
I think
go ahead.
from a female perspective,
Mm-hmm.
I've had a couple of clients that I've kind of used the feminist theory with. And so I think because there's a lot of shame sometimes just going into being a woman in society altogether. And then when you take it from a cultural perspective of being Black or you're overweight. And so I use the feminist theory to empower women, to encourage them to actually get involved and advocate with other women.
I appreciate it.
You're shamed because of the color of your skin, or you don't, add up to whatever the dominant culture says you should. So feminist theory works there.
Absolutely. So many ways in, right? The conversation is what matters. Having the conversation matters. And as clinical folks ready for the conversation, we become a better asset to the customer. We become a better asset and a better ally to the person who's trying to heal.